Hey there. Looks like you've been pushing it in the gym lately.
Oh, yeah.
We're diving into upper back pain today. Specifically, that feeling like you might have tweaked something in your traps.
Yep.
You sent over some interesting material that focuses on a very specific sequence for relief.
All right.
And not just your typical, like, roll it out advice.
Yeah, that's right.
Okay.
This sequence dives deep into the connection between your thoracic spine,
Okay.
ribs, and trapezius muscles.
Okay.
It's like a chain reaction.
Gotcha.
If one of these areas is restricted, it can impact the others and lead to that nagging pain you're feeling.
Okay, so it's all connected.
Exactly.
The first part of the material talks about T-spine mobilizations. I see there's a difference between using a foam roller and something called a double lacrosse ball or Gemini.
Yeah.
Is that because we're trying to be super precise with targeting the spine?
Think of a foam roller as a broad stroke,
Like,
while the double lacrosse ball or Gemini acts like a laser,
oh,
zeroing in on specific segments of your thoracic spine.
okay.
And for those who are serious athletes with really dense muscle tissue, there's even an option to add weight
Oh, wow.
using a plate or a heavy med ball.
Wait, hold on. A 45-pound plate.
Well, for some people,
That sounds intense.
Yeah, it can.
I'm all for pushing limits, but is that really necessary?
Well, think about it like this.
Okay.
If you've got a really tight knot in a rope, sometimes you need more than just your fingers to loosen it.
Right.
The added weight helps to release those deeper restrictions in the fascia,
Okay.
the connective tissue that surrounds your muscles.
Okay.
It's like a deep tissue massage on steroids.
Okay.
And for those who might not be ready for the intensity of a plate,
Right.
a med ball offers a similar benefit, but with more control.
I'm starting to see why this is more than just your average mobility routine.
It's definitely.
Now, the guide also mentions the T-spine overhead extension smash.
Yes.
Is that specifically for people who do a lot of overhead movements?
Exact.
I'm guessing that includes anyone who lifts weights or plays sports?
Anytime you reach overhead, whether you're throwing a baseball, lifting groceries, or hitting that PR on the bench press, you need your thoracic spine to move freely.
Gotcha.
This technique helps to ensure that your upper back can handle those demands without pain or restriction.
Okay, next up we have overhead rib mobilizations.
Okay.
I have to admit, I've never really considered how much my rib mobility could impact my upper back and shoulders.
It's a common misconception.
Really?
A lot of people assume that shoulder pain is just a shoulder problem.
Yeah.
But it often stems from issues further down the chain.
Okay.
Stiff ribs can actually change the position of your shoulder blade,
Oh, wow.
throwing off the entire mechanics of your shoulder joint.
Wow.
It's like a domino effect.
Sorry.
One restriction leads to another.
Right.
What's fascinating about these techniques is that they can be tailored to your specific needs.
Right.
If you're about to do a heavy overhead press, you can target the upper ribs.
Okay.
But if you're working on your back squat or deadlifts, the focus might shift to mobilizing the lower ribs.
So we're basically fine-tuning our bodies like a mechanic would fine-tune an engine.
Exactly.
Making sure everything's running smoothly.
Yep. That's a great way to put it.
There's also a part in here about organizing the scapula that caught my eye.
That's a crucial point.
Okay.
And it's all about restoring optimal shoulder function.
Okay.
You see, the position of your shoulder blade directly impacts the muscles that stabilize your shoulder joint,
Okay.
especially those rotator cuff muscles.
Yeah.
If your shoulder blade is out of whack,
Right.
it can actually shut down your rotator cuff,
Oh, wow.
leading to weakness and pain.
Wow. I had no idea the shoulder blade was so powerful.
It is.
So by restoring proper scapular position,
Yes.
we can actually reactivate the rotator cuff
Exactly.
and improve shoulder stability.
Precisely.
Wow.
It's a testament to how interconnected our bodies truly are.
Yeah.
Every piece plays a vital role in the overall function of the system.
All right, buckle up, because now we're getting into trap-focused techniques.
Okay.
And I have a feeling things are about to get intense.
It can be a little intense,
Yeah, okay.
especially if you've got a lot of tension in that area.
The first one is called the trap scrub. And the source material even uses the phrase meat tenderizing to describe it.
I can understand why.
I'm slightly terrified, but also intrigued.
This technique can be quite intense, especially for those who lift heavy weights. and have developed some serious tension in their trapezius muscles. But it's important to remember that the traps play a crucial role in stabilizing your neck and shoulders.
Right.
They're constantly working to support your posture and movements, so they're prone to getting tight and knotted up.
So this trap scrub is like a deep tissue massage.
That's a great way to put it.
For those overworked traps.
You can use a lacrosse ball or even a larger ball like the Supernova to apply pressure and literally scrub out those knots. It's all about creating friction to release those tight spots and improve blood flow to the area.
Gotcha.
Yeah.
And for those really stubborn knots, the guide mentions a contract and relax method. Is that like holding a stretch and then releasing it?
Exactly. You find that tight spot, hold the ball there, and then gently contract and relax the muscle.
Gotcha.
This helps to release the tension and allows the ball to work its magic even deeper.
So we've got our foam rollers, lacrosse balls, and even weight plates involved. It sounds like a full body contact sport.
Yeah, it can be pretty intense.
But I'm guessing the barbell trap mob takes the cake. For most creative use of gym equipment.
It might.
So how does this barbell magic work?
Wow.
So do I just drape it across my shoulders and hope for the best?
Not quite. There are a couple of ways to set this up. You can either carefully position a barbell over your upper back and neck. Or if you have access to a squat rack. Set the bar just below shoulder height and position yourself underneath. The key is to use your body weight to control the pressure.
Now I'm intrigued.
All right.
The guide mentioned something about a teeter-totter. An oscillation technique with the barbell. Are we talking about turning the gym into a playground?
You could say that the teeter-totter involves gently rocking the barbell back and forth across your traps.
Gotcha.
And with oscillation, you're slowly twisting the bar back and forth. It's like a targeted massage that really gets into those hard-to-reach spots.
Wow. I'm starting to understand why this sequence is so effective. It's not just about stretching. It's about actively mobilizing those tight areas.
Exactly.
And restoring proper movement patterns.
And that brings us back to that point we touched on earlier about scapular organization. You know, studies have shown that abnormal movement of the shoulder blade is much more common in people who experience shoulder pain.
So this isn't just about addressing the pain I'm feeling now. It's about preventing future problems as well.
Absolutely.
Wow.
Think of it as proactive maintenance for your body. By addressing these underlying mobility restrictions, you're not just treating the symptoms, but actually getting to the root cause of the issue.
That makes a lot of sense. I'd much rather prevent an issue than have to deal with it later on.
For sure.
But I have to ask, with all these techniques, are there any common mistakes people make when trying to relieve upper back pain?
That's a great question.
Thanks.
One of the biggest mistakes is focusing solely on stretching the muscles without addressing the underlying joint restrictions.
So it's not just about lengthening the muscles, but also about restoring proper movement in the joints.
Exactly. Another common mistake is neglecting the thoracic spine. Many people focus solely on the neck or lower back. But the thoracic spine is a crucial link in the chain and often overlooked. It's the foundation for your shoulders and neck. So if it's restricted, everything else suffers.
So it's like forgetting to oil a crucial gear.
Exactly.
In a complex machine.
A great analogy.
And I'm guessing another mistake is not being consistent with mobility work.
Absolutely.
Like anything else. Consistency is key.
These techniques are most effective when they become a regular part of your routine. Think of it like brushing your teeth. You do it every day to maintain good oral hygiene. Similarly, incorporating these mobility techniques into your daily routine can help you maintain a healthy, pain-free upper back.
So it's not just a quick fix, but an investment in long-term care for our bodies.
Exactly.
Now, I'm sure many of our listeners are eager to try these techniques out for themselves. Any tips for getting started?
Definitely. First and foremost, start slowly and gradually increase the intensity and duration of the techniques as your body adapts.
So don't go from 0 to 100 overnight.
Exactly. Second, pay attention to your breath.
Right.
Breathing deeply into the areas you're mobilizing can help you relax, release tension more effectively, and even get into those deeper restrictions.
It's amazing how much of a difference our breath can make.
It truly is.
And finally, remember that finding what works best for your body is key.
Yep.
Okay.
Not every technique will feel good or be effective for everyone. Listen to your body and adjust accordingly.
So it's all about experimenting and paying attention to our body's feedback.
Precisely.
Your body is your best guide.
This has been an incredibly insightful deep dive.
I'm glad you enjoyed it.
I'm already feeling more informed and empowered to tackle my own upper back pain.
That's great to hear.
I feel like I've actually learned something today. Not just how to treat the pain, but how to prevent it from happening again.
Exactly.
Yeah.
That's the goal. All right. Well, thank you so much for joining us today.
Of course. Thanks for having me.
It's funny. I came into this deep dive thinking we'd be talking about stretches and maybe a few foam rolling techniques.
Right.
But this has been like a masterclass in understanding how my upper back actually works.
That's great.
It's not just about treating the pain.
Right.
It's about addressing the root cause.
Exactly.
And taking a more proactive approach to my health.
I think that's a key takeaway here.
Yeah.
We've gone beyond simply treating symptoms and delved into the interconnectedness of the thoracic spine, ribs, and trapezius muscles.
It's like we've been on an archaeological dig, uncovering the hidden connections that influence our movement and well-being.
Absolutely.
It's like we've been given a secret decoder ring for our body.
Exactly. And then now you have the knowledge and tools to decipher those pain signals and address them with more precision.
So as we wrap up this deep dive, is there one final thought you'd like to leave our listener with?
This raises an important question for you.
Okay.
How can understanding the interconnectedness of your back, shoulders, and ribs change your approach to training on recovery?
Wow.
Think about how those connections might be influencing the way you move, both in the gym and in everyday life.
That's a powerful question.
I hope so.
It's a reminder that our bodies are these intricate systems.
They are.
And everything is connected. So the next time you feel that twinge in your upper back, don't just reach for the pain relievers.
Right.
Take a moment to consider what might be causing that tightness.
Exactly.
Could it be restricted movement in your thoracic spine?
It could be.
Stiff ribs?
Possibly.
Or maybe those hardworking traps need some TLC.
Precisely.
You've now got a whole arsenal of techniques.
That's right.
To address those issues head on.
Use them.
It's like we've graduated from passive patients to empowered mechanics.
That's a great way to think about it.
Equipped to fine-tune our own bodies.
I love it.
I don't know about you.
Yeah.
But I'm feeling inspired to put all this knowledge into practice.
That's the spirit.
A huge thank you for taking this deep dive with us.
My pleasure.
We hope you feel as informed and empowered as we do.
I hope so too.
Until next time. Happy mobilizing.